Good day, I am Mapul K. M. Kamag, a student nurse from Davao Doctors College, and for today's recording demonstration, I am going to perform the adult CPR and AED skills. So, let's assume that there is no pandemic as of the moment and you are walking since it is your day off. So, near the hospital you are working at when a citizen suddenly collapses. So, as a nurse who witnessed the cardiac arrest, you need to take the first action. So the first thing for the adult CPR is the assessment and activation. So the first thing to do is to shout help, but before doing that, you must make sure that the environment is safe for both the patient and the health provider. So let's see if the area is safe. So the scene is safe. Are you okay? Mom, help! Someone help! Next is to check pulse and breathing simultaneously, not more than 10 seconds, and check the carotid pulse if chest compression and the defibrillator is needed. So, let's check the pulse and the breathing of our patient. So, checking of the pulse, breathing, 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. After checking for the pulse and breathing, send someone to call for help and an AED to have the manpower and equipment to successfully resuscitate the patient. So, hey man in red shirt, please call 911. Next is the giving of high-quality compression. So, first thing to do is the proper hand placement using your one hand here while the other one hand is at the top of it on the lower half of the sternum. So, just like that. So, this is to provide the effectiveness of the chest compressions and avoid rib fracture. So, after placing your hands in the proper placement, give 30 chest compressions in no less than 15 and no more than 18 seconds. So, this is to ensure that the myocardial muscle is stimulated enough to provide adequate systemic perfusion. So, next is that the compressions should be at the depth of at least 2 inches or 5 centimeters. This is to increase the venous return and also ensure or for the heart to be able to pump blood effectively. So lastly is to let the chest completely recoil after each compression. So the patient has no pulse and no breathing. I will now start giving the CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Next is the adult birth. So, give 2 breath with a barrier device. This is my barrier device giving breath via oral. So, this will allow the oxygen to go inside the lungs of the patient. Also, by using a barrier device, this will help the healthcare provider to protect themselves from contagious diseases. So, and if a patient experience cardiac arrest during the COVID-19, then is it okay? So, not to give rescue breaths and just continue to perform hands-only CPR and wait for the help to arrive. So, but since our situation is we assume that there is no pandemic and out of the hospital cardiac arrest, we will give the rescue. That each breath should be given over 1 second, then ensure the visible chest rise with each breath. This will allow lung expansion. So, and lastly, resume the compressions in less than 10 seconds. So, give the rescue breath. Note for the visible chest rise while giving each breath. Perform 2 breaths. So, last part of this procedure is the AED or the automated external defibrillator. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. While the first rescuer continues the CPR, the help arrived with an AED and a bag mask device. Assuming I am the second rescuer, I arrived at the scene and brought the AED with me. So I will turn on the AED, then attach the pads while the first rescuer is still giving compressions, then wait for the AED to analyze the patient's heart rhythm and wait for the AED to instruct to clear the patient and to press shock button. So, to pads. Clear for analysis.
Shots advised. Charging. Stand clear.
Clear.
Press flashing shot button. Shot 1 delivered. Safe to touch the patient. Begin CPR now.
Let's switch roles now. Okay. As the healthcare provider switch roles, the second rescuer continues CPR and first rescuer gives rescue brief with the use of bag mask device. So, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. And lastly is to practice good team dynamics. So this helps to promote teamwork among healthcare professionals. Now, I am done with my return demonstration of the adult CPR and AED skills. Again, I am Mapul K. M. Muhammad from BSN 2 12D of Group 35. Good day, ma'am. So, for the pregnant, for the cardiopulmonary resuscitation for pregnant, in performing CPR in pregnancy, there is a bit difference with the normal adult. So, still 30 compressions and rescue breath. Our target position of doing high-quality CPR is in the middle of the sternum to prevent fetal injury. So, before doing that compression, we need to elevate right side of the woman at least 30 degrees. So, I will put the rolled towel or pillow under her right side. So, then after that, after 5 cycles of high-quality CPR, we will put our patient in a recovery position. Then, ensuring that her head is titled to keep open, her hand supports head and mouth, and toward the ground. So, and lastly, we will get flex the knee to stop body from rolling onto her stomach. So, let's start giving the CPR or the cardiopulmonary resuscitation and also the compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. To rescue breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. To rescue breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. To rescue breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. To rescue breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. To rescue breath. So, that's all for the pregnant. Again, I am Mapul K. M. Muhammad, a student nurse from Davao Doctors College from BSN 2 12D of Group 35. Thank you!